When you hear the words high blood pressure, what first comes into your mind? Well, it has to do with our heartbeat, blood vessels, and ventricles. When our heart beats, it pumps blood around our entire body. As the blood moves around the body, it pushes the size of our blood vessels. The force or strength at which our blood used to pull the walls of our arteries is called blood pressure. Our blood pressure is measured with manometer, whose measurement is in systolic over diastolic millimeter mercury. For an healthy individual, the range is 120 over 80 millimeter mercury. Any frequent increase above this range for a long period of time is called hypertension or high blood pressure. In our heart, two chambers called ventricle contract with each heartbeat to push blood to the lungs and through the arteries to our body. As the blood flows through the ventricles, the following factors may affect blood pressure. Blood volume, which is the amount of blood in the body. An increase in blood volume can make blood pressure to rise. Cardiac output, amount of blood our ventricle push out per minute. An increase in cardiac output can make blood pressure to rise. Resistance, anything working against blood flow through the arteries. Inability of the arteries walls to expand during heartbeats can increase pressure on the wall. By default, our arteries is flexible. Diameter of the arteries. Healthy body has the ability to increase the diameter of the blood vessel. This helps to lower blood pressure. Blood impurities. Our blood becomes thicker when we have so much substance such as fat and protein present in it. As the blood thickens, blood pressure increases, and this can make our heart work harder to pull blood into the body. High blood pressure forms over time as a result of toxic substance buildup, such as cholesterol, fat, and calcium buildup called plaque in the walls of our blood vessels or arteries. As the plaque enlarges, blood flow decreases. Blood cells start to stick to the plaque and then form clots, thereby reducing or completely block the blood flow, which may lead to damage to our arteries and then make our heart beat faster. If not properly managed, it may lead to high blood pressure complications such as stroke if the brain is affected, kidney failure if the kidney is affected, heart attack if the heart is affected. It can also lead to lost vision.